Hey guys, welcome back to my channel. Sorry I've been so late. Anyway, here is part 3 of the doctor versus nurse. I really hope you guys enjoy it, and I'll see you in the outro. Bye! So there's that stereotype, like Grace was mentioning, that only nurses are holistic and doctors are just illness-based. However, that's not really true, especially now. Things are changing in medicine a lot more. So you're gonna see that holistic care in the doctors as well, and in the whole team. Yeah. So, however, like with nursing, you're gonna be there a lot more with the patient, as we mentioned. So you're gonna be asking them questions not only about their physical health, but also, hey, how are you doing emotionally? Hey, how are you doing spiritually? How are you doing mentally? Like, tell me about yourself. Like what's going on at home? Like I want to help you in every way I can. So it's like a lot more personal. It's a lot more personal. So the doctors don't really get as involved when it comes to that, because it's more like, hey, how do you feel? How are you doing? And if it's something very serious, then the doctors do get involved. Yeah. But
it also kind of ties into like patient load. So for the most part, you know, nurses work with, how many patients do you guys work with? Five to nine.
Up, yeah.
Yeah, but like a physician will have, like if you're in the emergency room, a nurse will have 7 patients, and there will be 4 nurses in like a corridor, but then the physician will be responsible for 15 of those patients and have to see them all. So like definitely the patient load is different, and rightfully so, because the nurse needs to spend more time with the patient to provide the care that they need and like follow through with the orders and the medications that the patient needs. So I guess that kind of ties into like why we see that stereotype a lot.
Yeah, for sure. Nursing is a lot more preventative, I guess you could say, because there's more health promotion as the nurse, because like, not to say that doctors don't do that. Doctors definitely will promote health. They definitely do that. However, since you're there more with the patient, you're there more to like
explain things.
Yeah, like how can you like make healthier choices? Like all that teaching stuff, nurses do a lot of that, mainly because it's so basic that doctors don't really do it because they're needed somewhere else.
Yeah.
So,
and it definitely depends on specialty. Totally depends on specialty. Like if you're doing surgery, like you have to explain everything in detail. Like the patient has to understand.
It's so much
or like
complicated.
Even if you're in primary care too, like it sometimes exists, though nurses do a lot of that in primary care. So there's differences among specialty.
So your job security, if you do end up going to the medical field, is very high. You will always have a job. You'll always have a job. And yeah, so go get into the medical field.
Yeah, I think just within like the last 5 years, we've had like multiple medical schools being opened all around the country, a lot more programs related to healthcare.
Just to wrap up, can you tell me, Grace, tell us about why you chose the medical field, why you chose to get your doctorate, or just to be a medical doctor, and what, I guess, was like, what are some points that you think that others people could use in deciding whether or not they want to go be a doctor or a nurse or just go in the medical field in general?
That is a loaded question. So for me, what made me decide the difference? First off, I'm a huge nerd. And I ask too many questions. I love to know why about everything. But I did my CNA when I was 16.
We actually did it together.
We did it together. We did our CNA together, and it really put me into like a nursing, being surrounded by nurses, and like learning about that. I mainly did the CNA to be able to help at my family's business, but through that experience, that was I think that was kind of the finalizing point for me, realizing like I think medicine is right for me, just because I don't know, I'm not because I'm quiet, but just because like I'm not like that hands-on.
From the background.
Yeah, I'm definitely more of like a silent leader, so to speak, or a quiet leader. And I love talking to people. I love interacting with patients. Like that's one of my favorite things to do these days, is when I shadow or volunteer, is just talking to people on a one-on-one basis. But I kind of realized that like I really love the idea of diagnosis. I really enjoy, you know, the challenge of the puzzle of putting pieces together and trying to bring an outcome for a patient. And I also love to work with my hands. And so knowing that surgery was an option, surgery was a possibility for me, something that I am interested in, though I have no clue what I want to specialize in just yet. I wanted to keep all my options open. And I think I kind of just have that personality type. Like we were talking about this before we filmed, was like there's definitely a type of personality that goes behind the profession, like what you choose to do. And I just like really fit that kind of nerdy, quirky, but also like compassionate like side of things. And I didn't mind the school either. Like it excites me. Like I think that's one of the biggest things that helps you realize like this is what you're meant to do. This is like your vocation. It has to excite you. Nursing did not excite me the way medicine did, the way becoming a physician did. Like anytime like I was with a doctor or I was shadowing, and shadowing is a wonderful way to see if this is for you. Like put yourself in the healthcare setting. And it's hard to get shadowing sometimes. Like my like little spiel in like tip is like just keep at it, like keep asking. If it's something you really want to do, then you will do what it takes to get there. So, and definitely do a lot of soul searching. Something that like at my university that we do a lot is vocational discernment, and we write and we reflect on our experiences and on ourselves, and we learn about ourselves as people, not just as just humans, but also as God's children, and really take a step beyond just a career, but a true vocation. And so I have a lot of friends that, you know, started out pre-med and within the year have changed to like PA or PT or completely different and gone like a business route. Like really knowing that this is the thing you want to do. And you kind of know it's the thing you want to do because you're going to be willing to do whatever it takes to do it. I mean, that's been true for me, despite all the bumps and the hills in the road. And I think Rebecca like attests to this too, is like when you really want to do something, you're gonna put your all into it. And it's not gonna feel like a job to you. It's gonna feel like something that you really love. And for me, that rang really true for me. I have so much passion for what I do. Like for me to study all day and to learn about, you know, analytical chemistry and physiology and these things, this stuff excites me. So it has to be something that excites you. It has to be something you look forward to doing. And kind of that call kind of comes as it goes. Like I don't even really know how to answer like why you want to become a doctor question, because there's so many things, you know, there's so many things that you can take it at different angles. So kind of taking on to the perspective of a nursing student.
Yeah. Well, that's really good. And I think kind of the same for me. I decided to become a nurse because I did grow up also with this medical background. My parents are both CNAs. They also had an adult family home. And I had a cousin who went into nursing, and my aunts, I know for sure at least one aunt that went to nursing, and then I was really close to her growing up. We've been best friends ever since we were like 8. So I've always known that I wanted to do medicine, also because I really like the fact that as somebody who is a professional in medicine, you are always going to be needed on this earth. You will always be needed. There will never be a lack of need for a medical professional. And even if, for example, I just never worked again and was just a stay-at-home mom, I'd still be extremely useful, and I would still be able to use all of that I've learned as a mom. All of my information that I learned would always go to good use. And also the fact that if anything was to happen around you, like all of a sudden somebody was to fall over or something, or you had a sibling or a friend that was like just really sick, the fact that I'd know what to do just made my day. And like the fact that I'd be able to be helpful in that way, just that was like a huge plus for me. And then why nursing and not the medical field, or I guess specifically medical school? The reason why I chose nursing over that is because I personally wanted to just start working right away, and I didn't really want to do all that schooling. I love school for sure, but I know myself, and I know that I would get impatient trying to finish. And so yeah, it really depends on the person. I also was kind of worried that like, oh, what if I dropped it or something, and that I guess not knowing really if my life were to change, if I were to get married or something like that, would I still stick with it? And to being totally honest with myself, I wasn't sure if I would. Like for Grace, on the other hand, like she knows that this is what is going to happen. Even if huge life events came in and totally just changed everything, she would still finish. And I wasn't sure if I could answer that with that same confidence. So that's why nursing. Also because I am such a people person. Grace is definitely a people person too, but sometimes I just won't shut up and I will want to go talk to every single person and just befriend everybody that I know or that I don't know, befriend like a ton of new people. And I just love like carrying conversations with people, and I feel like I can get really close to people, and a lot of that is used in nursing. And the fact that it's so intertwined into my personality is very beneficial, and another huge reason why I chose nursing. So yeah, but overall, being a doctor, a medical doctor, and being a nurse or even a doctorate in nursing, they're still both critical and they're both supposed to work as a team. So yeah, and I hope that you guys were able to get something out of this, and we had a really great time filming it, and hopefully you guys, I guess, learned a lot and were able to be encouraged, or I guess pushed in the right direction.
Yeah.
I hope you guys enjoyed the video, and I hope you guys were able to get something out of it. God bless you guys. See you later.